I think to me, the best 55 word stories have some kind of either little twist or surprise or possibly a little gut punch at the end. And you're left
Mm.
going, whoa, that is something.
Hi, folks. I'm Jeff Kozlowski, host of the Next Step podcast. Today, I'm joined by Dr. Colleen Fogarty, Chair of Family Medicine here at the University of Rochester Medical Center. We talk about her practice of writing 55-word stories, a form that distills the emotional and human side of medicine into just a few powerful lines. Colleen shares how these tiny narratives help clinicians reflect, connect, and sometimes process the hardest moments of their work. And I think this can be applied not just for clinicians, but graduate trainees and postdocs as well. We also dig into her recent research on the growing shortage of family physicians in rural communities, why it's happening, what her team discovered in the data, and how training programs like the ones here in Rochester can help address these gaps in care. It's a conversation about creativity, clarity, and the future of primary care. Here's my interview with Dr. Colleen Fogarty. All right, Colleen Fogarty, thank you so much for joining The Next Step. How are you?
Fantastic. Thanks so much for the invitation, Jeff.
Absolutely. I'm looking forward to talking about creative writing and your experience there, and some of your latest work on looking at physician shortages in rural areas. But first, I want to just get to know your background a little bit more. Can you talk about how you wound up in Rochester?
Oh, fantastic. Yes, so I did my undergraduate at Cornell, and if there was ever a place I wanted to move back to, it would have been Ithaca. And as I looked at medical schools, I looked, all over the Northeast and in Chicago, and um, ended up at my state school, University of Connecticut, which was fantastic, had a great curriculum, had a good emphasis on primary care. And then looking at residencies, it was another chance. Like, can you get back to Ithaca? Well, you cannot. But Rochester was nearby, and I got an interview at the residency program. And the residency here at the University of Rochester in family medicine is one of the oldest family medicine residencies in the country. And it's also one of the most highly reputed. And in addition, they had a very strong, and we still do, a psychosocial training program. I had mixed feelings about it, some skepticism that maybe it was too much, but then also this fascination that it seemed really important. And I ended up matching here. So I was here for 3 years as a resident, 1 year as a chief resident, and then I practiced in a community health center in Albion, New York for a few years before we moved to Boston. I was on the faculty at Boston University Department of Family Medicine when their family medicine residency program was brand new. So I was there for just about 5 years as part of that program development, and then got recruited back to Rochester in 2004. Very happy to
When
be here.
you were a resident, did you ever think that chair of the Department of Family Medicine would be in your future?
Never,
No?
not at all.
So when, you got recruited back here, you mentioned, well, I guess first, when you got recruited back here, what was that? Was that for the chair role?
No, that was in 2004, and a colleague who also trained in Rochester, she was a couple of years behind me in residency. We both ended up in Boston together, and she had, I had gotten a note from actually the community health center. It was then Westside Health Services, and the interim executive director reached out to me and said, "Do you want to come back and work at the community health center?" And I didn't think a lot of it. And then I talked to my colleague, and she said, "You should look at that. But if you go to Rochester, you can't only look at the health center. You have to look at the academic department." She said, you have a lot of talent in academics. You really need to look at that." And at the time I thought, well, I had tiny, tiny kids, 3 and 1, and it was really hard to balance all the things. And I thought, I can take a community health center job again, be a clinician, do a little bit of teaching, and that will be just fine. But then I came and interviewed with the chair, Tom Campbell, at that time, and they wanted to hire me as a faculty in the department with my practice at the community health center. So it was a really nice blend.
Yeah, okay, that's great. And at what point then was, so now as chair of the department, I'm sure that role is a little different, and maybe a little more heavy on the academic side. Was there a moment where you were like, okay, I belong in academics?
Well, I think really from the time that I moved to Boston, the I was in that community health center practice for about 3 years. Really loved it. Loved the patients, loved the staff that I worked with, and I honestly, even in retrospect, it's probably the best run practice I've ever been in. No offense to the others. My mentors in medical school had said, Colleen, you're bound for academics. And I said, no, I'm not. I became a family physician to work in the community, to work with patients who need good services. I'm not going to academics. After 3 years at the health center, what I recognized about myself is that I wanted different things aside from patient care. Patient care is important. It still grounds me as a family physician. Um, and we were in a transition. I had gotten married and my husband needed us to move. So I thought, when I'm moving,
Mhm.
I will look at academic jobs and I will look at community jobs. And I found the academic job at BU, which was just right for me.
So, as a chair of department, there are, I'm sure, many responsibilities, administrative demands with leadership coming into play. But you also, and I know I sat in on a talk, I believe you were giving to psych students about creative writing and 55-word stories. How do you, before we jump into that practice, how do you balance all of these demands of leadership with more personal passions like writing?
Yeah. Well, balance is that elusive piece, right? I mean,
Mm,
if we look at the scales, they're never, there's always a little bit
no.
of so it ebbs and flows. I've for a long time I've just written little notes. At one time when I was at that community health center, I had a drawer and they were basically half sheets of paper that when we went to electronic record we no longer needed for their design purpose. And I had a stack of them and I just would pick them up and write something on the back. So I ended up with these um, just bits and bots. And periodically I would just look at them and think, I'd love to, build this out. And what it was things that really moved me in practice or really
Mm.
kind of stayed in my, I suppose, mind and heart as kind of the heart of what we do in family medicine, of really the first access for patients connecting on all kinds of levels. And I was working at the time with a very poor patient population. I still do, but now I have a more mixed patient panel. And some of the struggles and triumphs that I saw were just so moving. I just felt like I needed to put it down somewhere.
So what kinds of things were you writing? I mean, I'm guessing it was all kinds of messages and notes, but like just reaction to patient stories or things
Yeah.
people said or just anything.
Yeah. Yeah. Sometimes things people said. Um, there was at one point a patient told me he'd been a refugee from Cambodia, but he'd been in the US for a long time and his English was fine. And he he told me, you you have a heart. And it was like I was just kind of blown away by that. So just thinking about why he said that, why he came out with that, it was
Mm.
very interesting.
Yes.
And at one time there was, I can't remember all the details, but I may have been a chief resident, and someone at the medical center had um, a Tibetan Buddhist monk in, and he was consulting with people, and I talked with him, not very long, but he did the things that did, and at the end he looked at me and he said, "You think too much. You talk too much.
Mm.
Um, you need to pay attention to that." And I thought, what's my job? My job is thinking and talking and of course listening too, but that stayed with me, and I thought, wow, like what is that about? So that's ended up in one of my short pieces as well.
Yeah. So at what point, and so you talked to this psychology group that I listened in on about this creative writing concept of 55 word stories. And so when did you start kind of, or when did you discover that practice? And can you just kind of talk a little bit about what that is?
Sure. I think I'm not going to remember the exact year, but I think it was around, oh yeah, actually probably it was around 2008 where I saw in the Family Medicine Journal, it's the academic journal for the Society of Teachers of Family Medicine, there was an editor who put out a call for 55 word stories. And I didn't know what that was. And I looked at, they had published a few, and I looked at them and I thought, these look kind of interesting, kind of fun. And we had a departmental writing seminar that still exists where people can come and bring writing really in any stage. A lot of times it's people who are writing an article, a clinical article for a journal, or we have postdoc psychology fellows that work with us who are sometimes turning a dissertation into a manuscript. And I started bringing these because it was a great place to get feedback. They're short, so you think, oh, they're not going to take very long to review. But it turns out you can actually spend 35, 40 minutes talking about these. So that was a lot of fun. And sent I sent one, maybe one or two in for that feature. And that was really the start. Looking back, the form, as far as people can tell, originated with a guy called Steve Moss. He published a book in 1998 called The World's Shortest Stories. And those were fictional 55 words. And he had put out, he ran a small literary journal somewhere in the Pacific coast of California. And I think in a way to get submissions, he had a 55 fiction contest. And then the next time, as far as I know, that it appeared, or maybe the first time it appeared in medicine was 2000. JAMA features a column called Piece of My Mind. And two women internists named Ann Sheets and Mary Fry published an article where they talk about their own practice of writing these stories together. And their piece is called The Stories. So it's a really, really fun, it's a fun article. And as far as I know, that's, I think, what stimulated the editor of Family Medicine to start doing this.
And what would you say the purpose is of writing something that short? You mentioned like you can spend 35 minutes reviewing something like that. And I'd imagine with like, shorter pieces, that leaves a lot to interpret for folks or to unpack because there is so kind of little there. But so what would you say is the purpose of something like that?
Well, I'm going to read actually from Ann Sheets and Mary Fry's article because it's really gets right to that point. They say, for us, the rules are simple: to tell, preferably in 55 words exactly, a story that helps us to understand or to appreciate something about a patient or the practice of medicine. So obviously, this is the perspective of physicians
Hmm.
who've done that form. And I think it's really the heart of the matter. And, thinking back to why I had all these handwritten notes on little green pieces of paper, like I said, it's things that really stayed with me about the practice, myself as a physician, and or something really important or interesting or, you know, surprising about a patient encounter.
And why does brevity, like, when I think science and medical writing, I think thousands of words, right?
Yeah,
Why does brevity have such power in storytelling?
that's a great question. I think there are a lot of dimensions to it. One is that I think it can feel more accessible to people to write
Mm.
that, okay, it's only 55 words. How hard could that be? Um, and so, most of the time, if you're jotting something down, you have way more words. And the idea of distilling it down is maybe it's daunting, but it's probably easier than fleshing something out. I guess it depends who you are. And, for me, the power is there can be just a nugget of an observation or an interaction, and distilling that down to the essence is is it's important. And I think to me, the best 55 word stories have some kind of either little twist or surprise or possibly a little gut punch at the end. And you're left
Mm.
going, whoa, that is something. So I guess that's the best way I can describe it. And, since these have become more popular, people are using them in educational settings. I have a colleague who used to be in the Midwest, and she was using them on hospital adult inpatient rounds with her team. Here at the University of Rochester, Patricia Luck from the Department of Bioethics and Health Humanities just had her paper published. She uses 6-word stories, so it's tiny stories. Her paper literally just came out in Academic Medicine as an innovations piece, and she based her work on the idea of 55-word stories, but obviously went shorter. So there have been different examples in different places. The National Public Radio with Michelle Norris did the Race Card Project a bunch of years ago, and the instructions there were to write a 6-word story about race. And those
Mm.
are, phenomenal. So from a 6-word story, 55 seems expansive and awesome.
When you talk to students about this, like I remember the session I was sitting in on, you had folks in the room take some time to actually write one of these out. And I remember a lot of folks, surprisingly, at least for me, were open and willing to share. And that was
Yeah.
great. Is there
Yes.
anything that kind of, when you're working with groups on this, is there anything that is kind of like that surprises you in those moments? Or I guess not surprises you, but like things that you see that maybe students learn about themselves in the moment
Mm,
when they take the time to actually write one of those and share it out loud.
yeah, great question. So just to back up a minute for sort of thinking about the method, there's,
Yeah.
55-word stories. And, like I read the line from Sheets and Fry's note is they say preferably in 55 words exactly. Well, if you're going to submit a 55-word story for publication, it has to be 55 words. It can't be, 60 or 42. So that's that rule. But in starting in a workshop or an educational format, the preferably is the key word. And so I always want to set a safe space. First of all, a lot of people don't write at all and don't think that they can, that they have the ability. And so helping, encouraging people to just get beyond that and take out your pencil or your keyboard and just go. Um, and I'm not sure if this is true, but I think a lot of people in healthcare and medicine are pretty high achievers. And so if there is an instruction, people are going to get to it. So even in these like little 4, 5, 6 minute chunks, people have come out with these like exactly 55 words. But I do say, look, if it's a little longer or shorter and you're going to read it aloud, no one's counting.
Yeah.
But the moving towards that instruction. The other part about it is 55 words. It's a boundary, and it's a short boundary. So it's not saying, write a story about your life. It's the prompt might be write about something that surprised you this week, 55 words. And so it's something that I think is contained enough to work with that it invites people to give it a try.
Do you see any parallels? And I feel like maybe you mentioned this. I don't think I'm making this up, but there are some parallels, or at least this practice of writing 55-word stories, or just concise writing in general, does have effects and can be helpful in writing effectively for a scientific or medical journal. Is that right?
Definitely. Yeah. And as I said before, that, reviewing some of these pieces in our writing seminar, you think, oh, it's got to be short. It turns out, though, that when you have 55, every single word is important, and punctuation can be really important. And line spacing. Like, do you write these 10 words together, or do you write a couple and the reader's eye can follow along? So the format itself can be really part of the story, and they can be poetic in that way. They also can be sort of more straight narrative. But for me, definitely working on eliminating words in this format, in this creative format, just gave me a lot of, I suppose, courage and skill in looking at larger pieces and saying, yeah, we don't need that word, and we don't need that word, we don't need that phrase. So I think that even though this is a more creative piece, the practice of editing down and trying to figure out what are the essentials, what's the most concise and clear I can be with still giving a complete um, exposition in a scientific paper has been incredibly helpful in that way.
And I think I remember you saying something like the phrase "start where you are." Um, what what does that mean in the context of writing? When you're encouraging trainees, like if they're struggling to start
Hmm.
something, you say "start where you are." What exactly does that mean?
So in a workshop like the one that you saw with the Department of Psychiatry, the whole thing was not workshop, but those minutes that I set aside for that, it's helpful to have a prompt.
Mm-hmm.
So any writing workshops I've been in, the instructor will give a couple of prompts, and then the I make it spoken, but sometimes the unspoken one in a writing workshop is, if you don't like any of these prompts, start with what's on your mind.
Mm-hmm.
So, the prompts can be broad, write about something that has surprised you in the last week. Write about something that's stuck on your mind and you can't get it out. Write about an interesting patient interaction you've had in the last couple of days. Or you don't like any of those, put it down. And there's been some incredible material that's come out. I've done the grand rounds now in bioethics and health humanities, the Highland Hospital primary care grand rounds, Division of Geriatrics, and
Mm.
as you were at the psychiatry. And it feels like a leap of faith. People will take the 5 minutes and they will do what they do. I think most people write. I don't keep track, particularly on Zoom. I couldn't see the people in
Sure.
psychiatry, a lot of them, but a lot of people will write, and then inviting people to share it. I did something like this a couple years ago at Highland Grand Rounds, and I don't think anybody shared. That was fine. But these last times I've done this particular one this year, every time there's been at least four people who've wanted to read. And that to me is kind of magical, that people could take 5 minutes and get to a place where many times they're very vulnerable things that have happened, or really tender things, and people have written that down and they've been willing to read it aloud to their peers. So it feels like an act of faith to open that space. And when it's open, I just think there's such I don't know, magic and connection that can come out.
Yeah, one of our previous guests on this podcast was Dr. David Coronis, who also writes not the 55 word stories, but submits a lot of editorial pieces to journals and about his experiences with children experiencing illness, or he's done stuff on going to their funerals, unfortunately, after their passing, and that experience. But just as a physician in that space, and he talks about just getting stuff out
Hmm.
is, I don't know if this was the right word, but like therapeutic, or it's just
Oh,
like
yes.
necessary to get stuff out. Do you see this kind of writing too, like playing a role when it comes to wellness in medicine?
Definitely, yes. And I've taken this from the point of view of a format, a form that's accessible really to healthcare audiences. There's a whole literature around the therapeutic writing, and there are therapists who will use writing or journaling in their practice. That's not my angle, but obviously I'm
Mm-hmm.
not against it. But I think for the personal, clinician, and I know that there have been, scientists who've been in the room. Actually, the one with psychiatry, there was a 50-year grad student in maybe astrophysics who came. Um, so it's a way to, like Dr. Corona says, take that stuff in there and put it somewhere. Just naming the thing alone and writing it down can help free it from your own self. So yes, I think earlier I talked about things that were, touching or memorable or surprising, and certainly I've written about things that are sad or painful and much more heavy, I suppose. And that's a good way to get those out.
Yeah, and I would imagine a lot of this stuff never sees the public, right? And like a lot, sometimes I know folks can get caught up on like writing and, putting it somewhere, but I would imagine a lot of the little notes that you wrote down just stayed there and were just a way to, like you said, get it out or put it on paper somewhere. So it's
Yes.
not eating up in here and in here.
Exactly. And like I said too, there's a couple of threads. One is if you want to publish, and that's okay, not mandatory, then you follow the exact rules. If it's for you or even a small group that you want to discuss with, you don't have to follow rules, but getting it out there in some way can be so, so helpful. In other exercises, not, I've never done this obviously in the medical center, but there are, you hear about maybe more spiritual things where people will write some things down from the year that they want to let go, and they'll like have a little fire and put them in the fireplace type of thing.
Mm.
So there's all kinds of ways that we can use, what's in our head and heart to get it out on traditionally piece of paper and then either work with it or just literally let it go.
If someone is listening to this and, it's a busy graduate student or clinician and think like, oh, I'd love to write, but I don't know, I don't have the time, but I can
Yeah.
see the benefit. Is there like a general first step you'd recommend that they could take right away?
Well, not to be cute, but there's always the Nike just do it. Um, and that sounds, whatever, humorous or trite. I imagine, students or grad students like, walking around campus, going from class to class, grad students maybe less so walking around campus, but maybe in a lab or in a clinical setting where it's thing after thing after thing.
Mm.
So people's lives are really busy. And I do think that giving ourselves permission to even take a 30-second pause or even 1 minute, wow, 1 minute, and just write a bunch of stuff. And it's actually really surprising to me when I actually allow myself the minute. I can write a couple sentences and then it's like, oh, I'm glad I put that down. I can come back to it later, or I don't. So I think the starting is important. And a colleague, sort of a senior amazing family physician called Lucy Candib wrote about writing. It's a terrific essay, and she talks about desk clearers or wedgers. And this is more around a bigger project, but she said, wedgers are people who just kind of do a bit here and a bit there, and eventually they move it to, and desk clearers are people who really want to more literally, block a few hours,
Mm.
metaphorically or literally clear the desk of anything else and just get in and focus. I would love to be a desk clearer. Occasionally I can be, but mostly I can't. And so then it's wedging something here, wedging something there. And the sabbatical I was really grateful to take at the end of last year allowed me to pull some of that material I've been accumulating for a long
Mm.
time and actually sit and look at it and take that amount of time that I needed for it. So it's it's a both and, I think.
Yeah, we tend to underestimate in a lot of aspects of life, I think, the power of like a little bit here and there, like just
Yeah.
like doing 10 minutes to work, 10 minutes to take a walk, or 10 minutes to do a quick workout versus a whole hour in the gym, or, and same. It's just that concept, I think, or that lesson can apply to so many aspects of life because it's and all that kind of adds up
Yeah.
cumulatively over time to, for benefit.
Yeah. Even
Um,
self-care, as I was supervising residents in their outpatient practice one afternoon at the end, we do, kind of wrap up. They come in and sort of run their list to make sure, patients and they've gotten what they needed. And I had two residents in a row who said, um, well, let me finish. And somehow it came out that they needed to use the restroom. And I said, well, why don't you use the restroom and then we'll wrap up? No, 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 I just want to get this done. And then and it's like, wait a minute, no. So with one of the residents who's now a fellow down in Georgia, we actually wrote a short piece for the family practice management. They have a little end cap. And we wrote a little piece about how still in 2025, which I think our learners have come a lot further in allowing themselves to be human and stay human.
Mm.
Still, I have these young folks who are like, "Oh yeah, I'll wait to go to the bathroom. I'll just get this work done first." Like we can, So if you feel like you can't use the bathroom, how are you going to feel like you can write? But I think
Yeah,
let's let's take care of the body, and then it's okay to spend a few seconds taking care of the soul too.
I love that. We're gonna just take a uh, quick turn to one other subject I want to hit on because it's timely as we record this podcast, and then we'll circle back around to creative writing. But I know, Colleen, you recently came out with some research on physician shortages in rural
Yeah,
areas, just kind of the drop there in the last few years, and I just want to put some time toward that. Can you just give us an overview of the work you've been doing and what you're seeing as far as what's going on in these rural communities as far as physician
sure.
shortage?
Sure. So the 6 month sabbatical that I mentioned was an incredible opportunity to pause, and I really wanted to do both creative work and empirical work together during that time.
Hmm.
So the Robert Graham Center is an arm of the American Academy of Family Physicians. That's a policy and research group who are editorially independent from the AAFP, but it's the same organization and they have a visiting scholar. So I spent 2 months in DC working with that team and another team I really wanted to look at burnout among family physicians across the pandemic.
Hmm.
In the process of defining our sample across the country, really, it wasn't even a sample, it was like the universe of family physicians who practice office based primary care. As we divided the demographics and looked at that first table one, if you will, then the drop off among the rural segment was really notable. So we knew that that was an important finding. It's been known, but I don't think the numbers had really been defined or pulled out in this way. So from 2017 to 2023, which is really where the most updated data is, found overall in the country an 11% decline in family physicians practicing in rural areas. Um, it doesn't say, like, this is number of humans, so it doesn't say who's full-time and who's part-time. So we're not measuring like people who had a full-time practice and then drop back to 2 or 3 days a week. But it represents a huge loss in access for patients. Across the country, family physicians provide the bulk of primary access care. Certainly, general internal medicine doctors do as well. That that pool is diminishing more so than the family medicine. And nurse practitioners and PAs also are important contributors to the primary care workforce and are not they're not entering primary care or rural practice at a rate that would sustain what we need as a nation.
And I know, you're looking a lot at the data, and is there anything in there about just kind of why that is declining? Why there people are leaving rural areas, or is it burnout? Is that a big factor, or?
So these data sets are the American Medical Association Physician Master File, and then we also used data from the American Board of Family Medicine. So these are questionnaires. There's not an
Mm.
area for reasons. We
Hmm.
do know from qualitative study that put out by the Larry Green Center for Primary Care. Actually, I worked a bit with them on sabbatical as well, but they did flash surveys throughout the pandemic asking primary care people of all kinds, what what are some of the issues? Where are you at with the pandemic relief financial program? Where are you at with this and that? And there were qualitative areas of that, which I looked at, and the other team has looked at it. But there were a lot of comments about needing to step back from practice because of, burnout, feeling overwhelmed. There was one
Mm-hmm.
person who commented that they had such a hard time practicing in a community where many of the physicians and other healthcare professionals did not believe in masking or vaccines, that they felt like they couldn't tolerate being in that environment, and so they had to leave practice. So again, my study doesn't show that because that's not the kind of data that we have, but some
Right.
of the qualitative data that's out there does show some of those reasons. And primary care was in a challenging state before COVID happened, and I think COVID really accelerated and worsened a lot of what we're seeing now.
And as you mentioned or as was mentioned in the article on the URMC newsroom, education can make a difference
Yeah.
in some of this. So, what is happening here at University of Rochester to sort of help with this?
Yeah. So nationally, there have been a number of areas, residency programs and other institutions that have had rural track training programs. So this is not new. And in
Mm-hmm.
fact, we had one, the Department of Family Medicine had a rural training track probably 25 years ago that lasted for a brief amount of time. Now we are developing a rural training track with partners at Tri-County Family Medicine and Noise. And it's really been an exciting experience that, the University of Rochester Medical Center and UR Medicine is affiliated with a number of smaller hospitals across the Finger Lakes region. And a huge need is to ensure that there are primary care physicians and other clinicians who can care for people. And then when those patients are seen, if they need higher level of services, they can go to their community hospital. They can, come to the University of Rochester, strong to get higher level things that aren't available in smaller communities. So we're working with the support of a Health Resources Service Administration grant to plan a rural training track. And we anticipate that our first residents for that class will be matched in 2027. They do their first year of a 3-year program in the city. So they're getting high volume adult medicine in the hospital. They're seeing dozens and dozens of patients. On maternity, they're attending and helping and working with multiple deliveries, dozens and dozens. And then their second year, so this will be 2028 June if everything is going to schedule, 2 will go to have their primary practice at Tri-County Family Medicine, and then we'll do the rest of their rotations at facilities and with specialty groups throughout the region. So our residency director, David Hollab, and our education administrator, Alex Doucette, have been working very closely with the regional team at URMC as well as partners in Dansville to get this going. So it's very exciting.
Yes, very exciting. Thank you for sharing that. And I just have a couple questions left, Colleen. This has been great. Back to the 55-word stories. I would assume you've written lots of these, but if there is one you'd be willing to share before we wrap up here, I would love to hear it.
Okay, great. I thought about this, and I'm going to share the one that I first wrote and published. I think this is one of the it's one of the things that just stayed with me, and so that's why
Mm.
I wrote it. And this was published in 2008 in that feature I mentioned in the journal Family Medicine. It's called Blue Velvet. Bring your meds. He always did in a blue velvet bag, an elegant offering each visit. Weakness, paresthesias falling. He couldn't wipe. Cervical stenosis, delays, frustration. Finally, neurosurgery and rehab. Months later, a follow-up visit. He hands me his meds in a crumpled brown paper bag. Where's your blue bag? The hospital threw it away.
And can you share maybe just a little bit of, how that story came about? Did it start with a note in your desk and then, take it from there?
I can't honestly tell you that. It may
Yeah.
have, but I think it was this gentleman. He always had this bag, and it just it was cool. I mean, it's just the whole stories to be written about the various things people use to bring their medicines in, but it was notable every single time. I took care of him for years, and then after he got back from the hospital, it was this little scrubble thing, and I thought, oh, and to me, it just represented so much loss. He'd
Mm.
lost function, he'd lost time. He wasn't home. He was a person who always wanted to be in his house. He was in rehab for weeks and weeks. And so the fact that he no longer had it, and that, the hospital threw it away. Who knows what happened? There are many things that happen in the hospital, and, unfortunately many stories of people who lose things or this or that. And I'm not justifying it or criticizing it, but it's real. And this was one thing that, I mean, I know him as a human, and I know he was cared for as a human, but this was so representative of kind of how he was in the world, and it was gone. So I think that just moved me to write it down.
Well, Colleen, thank you so much. I appreciate all of your time and sharing your story with us. If anybody wants to connect with you about, if they have questions about 55-word stories or anything like that, where can they best reach you?
So I am on LinkedIn, and it's my full name, no middle initial.
Perfect. Okay, I think that's all I had. Is there any parting thoughts, anything we didn't talk about that you want to get across, or did we cover everything?
Seems like we covered everything. Yeah,
All right.
great.
Well,
Yeah, thank you so much.
thanks so much for tuning in to the latest episode of the Next Step podcast. If you liked what you heard, please share with other members of the University of Rochester community or anyone you think could benefit from these career stories. And we wish you nothing but the best in your own career journey. Until next time.